go through ALT services and you have multiple attempts, it significantly increases your chance of success. So what that means that a lot of couples who need this service are not able to afford it. That is the unfortunate thing about the treatment, about the wisdom that is needed to overcome infertility. And that is why I have come to the conclusion that the two barriers to overcoming infertility are poverty and ignorance. Poverty and ignorance. You take away poverty, a couple who has the resources don't have a genotype, is an SS baby. This technology is available to avoid that. But like I said before, it's expensive. But if you have the resources, then it is mission possible. And of course, ignorance. And that is why we are putting up this forum together to ensure that we are able to educate the public on the knowledge that is available, the wisdom that is available to overcome infertility. So we'll be talking about the burden of infertility. The burden of infertility is real, particularly in this part of the world. In Nigeria, the presence or absence of a child in a home can determine if that marriage succeeds or fails. Because there are many marriages that have failed, that have broken up because of no child. So the pressure is a lot. Again, in this part of the world, the pressure is so much on the woman. The woman is the one who bears the brunt. Why are you not getting pregnant? And we have just said that 50% of the time, the problem is with what? Is with the man. But in our society does not believe that the man has any problem. How can you see a full-grown man, chested, with muscle, say he cannot get a woman pregnant? It's not possible now. The woman is the problem. Oftentimes, they will tell you, okay, go and check yourself. And if there is delay, madam, step aside, let another woman come in. And then you see the man bringing another woman. He may not bring, he may say, okay, if you can't go, let me go outside to go and exactly, get it done. And then only for them to realize that he's been the man all along. And I've come to realize that when you see a couple that have never achieved conception, couple have done 5 years, have done 10 years, and the woman said, I have never been pregnant. Check it. 80% of the time, the problem is with the man. Because if the man has very severe low sperm count, there is no way that woman will ever get pregnant. And in all that time, the man never checked. So, and guess what? The simplest test to do is with the man. The semen analysis. Very easy. And then you will know what the problem is. And coupled with that is the fact that with that, you now have a very high rate of depression, anxiety, not able to cope at work. The couple go through a lot. The burden is so much. I had a patient that I saw some few days ago. She's our patient. She's come back to want to start off another program because the last program she had, she got pregnant, but she lost the pregnancy at 21 weeks. And she told me that, doctor, I just came back from treatment. I was admitted for 4 months in psychiatric hospital. She lost it. And we have patients like that who, from not being able to have a transfer done, just just went off and had to go through psychiatric treatment to ensure their mental state was okay for them to continue this journey. So this journey is it's a journey that nobody wants to go through. I often have heard women say that, see, I don't wish this on my worst enemy. If there's something else I can go through, but not this journey of infertility, please, I want to. Because this journey is not easy at all. And so I've come to understand, not just because of hearsay, from personal experience, that it is not a journey that you go through lightly. It requires the grace of God, the help of God, to be able to go through this journey successfully. The journey, it's a burden that has torn marriages apart. It's a burden that is associated with a lot of stigmatization, marginalization. The burden that has really, created a lot of friction in the society, in the homes. And so, whatever we can do to reduce this burden, to turn pain to gain, to turn mockery to celebration, we are passionate about running with this vision. And that is why we do what we do. And by the grace of God, the JOJE Abebe Art Foundation, in collaboration with the JOJE Abebe Fertility Center, is committed to reducing this burden of infertility in our country. But what is infertility? We'll be talking about infertility. What is infertility? Just for us to be able to have a definition so that we have a proper understanding of what infertility is. Infertility is the inability of a couple to achieve conception after 1 year of regular, unprotected sexual intercourse. Or 6 months for a couple that is above 35 years, as the woman is above 35 years. Or for a couple that already know they have a challenge already. So, what that means that if you got married and you've been trying to achieve conception for 1 year and you've been having regular intercourse. When we say regular, we mean you are meeting with your spouse 3 to 4 times every week. 3 to 4 times every week. And you're not able to achieve conception, then we say there's an issue of infertility. It is very important, 3 to 4 weeks. That is very important because we see situations where couples are not meeting regularly. And if you don't meet, how are you able to achieve conception? All right? How are you able to achieve conception if you're not meeting regularly? And so, what is defined as regular is 3 to 4 times every week. I say, doctor, you want to kill somebody? 3 to 4 times. We understand that the rate sexuality is really have been impacted so much, particularly this time. And unfortunately, if you don't meet sufficiently enough, then you lose the chance of achieving conception. Now, what many are not doing is they are not targeting ovulation. Trust me, for you to target ovulation is not easy. Not easy at all. Because when you think a woman is going to ovulate, it's possible she has already ovulated. Or it's not even yet time. They say, oh, no, I can track it. You track it, yes, you can track it, but it's difficult. And that is why what we normally will encourage is just meet your wife. What are you doing as a man? Meet your wife. Okay? And then make sure that the frequency of intercourse is It's about 3 to 4 times a week. So what are the types of infertility? You have two types of infertility, primary and secondary. Primary infertility is when the couple has never achieved conception. The woman has never been pregnant. Never, not in once in her life has she been pregnant. That is referred to as primary infertility. Why secondary infertility is when a woman has been pregnant at least once, irrespective of the outcome of the pregnancy. Whether she gave birth, whether she had a miscarriage or stillbirth, whether she had an ectopic pregnancy or she terminated, irrespective of the outcome, as long as that woman has ever been tested positive, is classified as secondary infertility. And there are implications for whether it's primary or secondary. When I see a couple who has never been pregnant, a woman has never been pregnant before, but the causes of infertility that goes through my mind, I begin to look at the pictures. It's different from a woman who has been pregnant before. And how we manage them is a bit different. So, what are the causes of infertility? You have male and female causes. Like I said before, the ratio or the contribution of these factors are 50-50. The woman does not share more, neither does the man share more. It's 50-50. But we'll just touch briefly on some of the factors. On this forum, as we hold these meetings every month, we'll be giving some depth as to some of these causes of infertility so that we can be properly informed. It's important for us to know that 50% of all male infertility, because it's not known. So you see a man who has low sperm count, low motility, very poor morphology, and you're wondering, why is this count low? You can't tell. That's what we classify as what idiopathic. You don't know. Very severe low sperm. This man is healthy, lifestyle is good, does not smoke, does not drink, no hard drugs, live a decent life. Why is the count low? It's called what? Unknown. That is idiopathic. All right? And then, of course, lifestyle. Lifestyle is a very big factor that can affect and cause male infertility. Men that smoke, men that drink or take hard drugs, it all has impact on their sperm parameters. And so when a couple comes, and part of the thing we ask is, sir, do you drink? Well, yeah, a bit. Do you smoke? Well, no, not really. I stopped some years ago. Oh, I drink. Smoke. Well, I'm trying to curb it, but I smoke. Those are factors that can affect the sperm parameters. What else? Infection. Hepatitis, infection that affects the testes, affects the ducts, varicocele, the enlargement or the enlargement of the veins that drains the testes, genetic factors, infertile, hormonal factors, those testosterone, surgery, previous surgery, hernia surgery, prostatectomy. These are all factors that can affect the sperm count. All right. What about the female factors? Under the female factors, you have ovarian factors, tuber factors, uterine factors, and pelvic factors. Like I said before, we're just doing a summary of these factors as we go on. This is our first inaugural forum. A subsequent forum will be giving depth into some of these. So we'll be talking about our success story at the JOJE Abebe Fertility Center. It's been an amazing journey this past almost 8 years. The JOJE Abebe Fertility Center is a fertility center based in Abuja. For now, we're just in Abuja, but very soon we'll be everywhere because infertility, we are ready for you. We must overcome you. By all means, we are currently based in Abuja and we provide comprehensive fertility care to couples trying to achieve conception. The center was established and officially dedicated on the 22nd of June 2016. That's, by the way, is our wedding anniversary. All right? What's the vision of the JOJE Abebe Fertility Center? To become the leading fertility center in the world, running the largest number of circles with the highest clinical and pregnancy rates. And I want to say, to the glory of God, last year we had an amazing result, 56% average success. To God be all the glory. And since we started, it has been from glory to glory. From the average national of 30-something percent, we moved to 40-something percent. And last year, we entered into our 50-something percent. We never dropped below that 50 all throughout last year. God did amazing things for us. And so we are on a mission. And what is that mission? To provide excellent and quality but affordable fertility care using state-of-the-art equipment with a well-trained and experienced workforce in a warm and loving environment. That's our mission. That's our mission. I can proudly say that right now, through the foundation, we run the lowest affordable fertility service. Check anywhere. Comparing service and success to cost. I'm not comparing with centers who say they do 500,000 IVF and go there and know it. They come to us, they tell us the story. I'm talking about cutting-edge service. The top-ranked centers in the country. By the grace of God, through our foundation, we are able to meet our mission. And over these almost 8 years, what has been our success story? Over 11,000 couples have been reached out. Over 5,000 have had fertility consultations to counseling. Over 1,000 have had IVF treatment. And over 450 have been confirmed pregnant and have had their babies. Singletons, twins, triplets, quadruplets. But please, don't desire quadruplets. Even triplets, don't desire triplets. Because the risk is very high. Twins. Desire what we have. We have twins. Receive twins. I say receive twins. So that is what you should desire. Twins. Okay? Now, I'll talk about introduce the JOJE Abebe Art Foundation. Now, this was established about 8 years ago. It was officially launched at the dedication of Joshua and Jemima. And by the name, by the way, JOJE is from the acronym Joshua and Jemima, JOJE. All right? It was the birth of our babies that brought forth this ministry. Because why? We understood that there is a reason for everything. That God took us through 12 years of waiting, 6 years of treatment, 9 IVF circles was not for nothing. And that with what we have experienced, with the comfort we received, we were not positioned to comfort others. So what we're doing is turning our pain to gain. And so their birth and dedication gave birth to the foundation. And what is the vision of the foundation? To provide a support system for every couple on this journey to parenthood. They need support. Trust me, you need support. Every couple going through infertility needs support. The vision is to provide all the necessary support that is needed by couples on the journey to parenthood. What are the supports that are provided by the foundation? You have financial support, which we have provided through discounted IVF programs. For example, the Be Fruitful Fertility, Be Fruitful project that is still on. That we will talk about very shortly. To provide psychological and emotional support through our counseling and support group. Support groups we'll be introducing this year. To provide spiritual support through our JOJE prayer group. For those of you who are not aware, we have a prayer group and we meet every Tuesday and Saturday to pray for one another. Why? Because if it was in your power, you would have gotten pregnant longest time. What you cannot do for yourself, you need to put your trust and your confidence in God. And what more, is a great opportunity to serve God on the prayer altar. Because what you make happen for others, God will happen for you. So we have the provide spiritual support, and then, of course, education. And that is what we are doing right now, to provide a platform for education and information on human reproduction through the Fertility Forum. All right? Now, our success, the success story of the Be Fruitful project. This project was launched 14th of February 2021. So this February will be 3 years. Okay? And what was the vision? The vision was to reach out to 10,000 couples with very affordable IVF treatment program in a 5-year period. At the start of this program, listen to what the cost was. 2 cycles of IVF was to cost how much? 500,000 in 2021. And that included a free registration and consultation. Part of the investigation was covered. For those who were doing basic investigation, it was completely free. It was part of that 500. And those who were doing standard that included hormonals, you pay an additional cost. It included what? Medications. And then additional cost for those who were doing programs like third party. That was how we started that program. When that program started, many who saw it thought it was a scam. Not possible. Yeah, how? How can you offer that kind of program? But to the glory of God, in this almost 3 years period, I will shortly will be telling us what our good report has been. But that program currently right now, almost 3 years, 2 cycles of IVF is now 800,000. And then, of course, there are now additional costs. But even with that, it's still the best deal around. The best deal around. The best affordable rate for IVF in the country. So what is the good report from the Be Fruitful project in almost 3 years? Over 10,000 couples registered. So we had already, in terms of the number of couples we wanted to reach, we had the number. But again, like I said before, poverty, ignorance are the major barriers couples achieving their heart desire. Spiritual problems. I agree. But to assessing fertility treatment, number one problem, poverty. If I have my way, and that's why I'm trusting God, and that's why this year we're going to be launching a project, what we call turning your pain to gain, where we want to reach out to everybody. God has blessed you. You have gone through this journey. You have your children. But there are others who are still going through this journey. Help them. Nothing is too small. Nothing is too big. And I believe that because all fingers are not equal, if people are willing to give or pay more to ensure that other people go through this journey, we'll be able to take much more, many more people on this journey. But God has helped us. In almost 3 years, 10,000 couples registered, over 4,000 consulted. There was a time we were doing free consultation, free, with specialists. Over 850 couples have gone through IVF treatment. Over 370 of the confirmed pregnant and over 400 babies. In our almost 8 years of existence, I want to say that most of our programs have been discounted. We'll be running discounted programs right from the very beginning. Because we knew that our mission was to provide excellent and quality, but affordable fertility care. And God has helped us. To God be all the glory. Our joy is seeing this couple who previously were termed barren, see them and see God's word fulfilled in their lives. All right? But even with what has happened, there's still the barrier of cost to overcome. There's the barrier of cost to overcome. And it's worse now, or let me say it's more challenging now because of the high inflation. All of you are aware of what is going on in the country. The cost of things is skyrocketing. And for us, in particular, in this area of business, where we depend so much on the dollar, the devaluation of the naira has made it that the cost of rendering service has gone up so high. And what that has meant is that it has made ART services very, not just expensive, very expensive. And so it's currently out of the reach of most Nigerians. Because for you to afford 1 circle of IVF now, you need to have about 2 to 3 million to be able to afford it. That's a regular rate. Don't mind our foundation rate. I said, but that is significantly discounted. And this cost of service will depend on the type of program you're running, number of circles or attempts. So currently at the JOJE Abebe Fertility Center, our regular prices is what you're seeing. Next slide. 1 circle, 1.7 to 2. 1, 2 circles, 2.6 to 2.95. 3 circles, 3.5 to 3.95. Now this range depends on what program we are doing for you and the cost of medication. All right, that is what is the range. And to be more specific, these are the prices. It's high, right? Some people have taken a deep breath. Oh, God help us, God help us, God help me, God help me. It's unfortunate, but that is the reality. See, different centers have different price, but this is just about the range. There's some centers where 1 circle is as much as 3 million, 2 point something million. You understand? Now, when we say 2 circles, we mean the number of attempts. Because, like I said before, IVF is not 100%. But we, by the grace of God, this last year we had a 54%, 56% average success. So imagine if you have a 2-circle program or a 3-circle program, you're almost guaranteed that you will end up successful. So that is why we have 2 circles and 3-circle programs. All right? But through the foundation, I wish many patients would come and pay our regular rates. I want to make a special appeal right here. All of you who are listening to me, both physically and online. All fingers are not equal. All right? All fingers are not equal. If you can afford the regular rate, please go for it. If you can afford it. And I know that there are some who can afford it. I will dwell more about that when I go down on the presentation. So, but let me talk about the fruitful project price. The current Be Fruitful price is significantly discounted based on a high inflation and economic reality. Like I said before, what we have right now is 2 cycles of IVF for 800,000. And then there are additional costs based on what program you're doing and the cost of medication. But even at that, you will agree with me when you compare what I'm talking about to the regular price I just mentioned before. There's a whole lot of more than 50% discount. All right. But an increase is needed because that 800 was the price that we had since last year, the beginning of last year. Between last year and now, prices have gone up. In the next 2 slides, I'll be giving you an example of the difference in prices. I'm going through all of this length to explain to our dear client because they need to know why we do what we do. Because I know that some of them have, accused us and said, that center, they are very good, though. Everything is fine. It's just that they increase their price frequently through the foundation. Not our fault. We started with 500 almost 3 years ago, but now we are doing 800. I can assure you that what price was 3 years ago is not what it is right now. Or it has more than doubled. For example, what was the exchange rate 3 years ago? 3 years ago, when we started this program, we were going through the bank, we were exchanging and buying our consumables and medications at probably 400 and something. I can't remember now. 400 and something to the dollar. Even as at just before the new regime came, what was the exchange rate? It was still about that 490 something. Why in the black market it was about 700 and something. But what is it now? Well over 1,000. More than 2 times double the price. And everything we buy is all based on the dollar. I'm laying this foundation for what I'm going to be saying subsequently. All right? So there's an increase that is needed because without that increase, we will not be able to offer the quality service that we have to offer. So what are we proposing? That the current 800,000 for 2 cycles be increased to 950. I'm only in, it's not in their face, but in their heart. I know that say, doctor, please, nah. Hey. It's also affecting us. All right? And then, of course, in the additional cost, there will be an increase that will be appropriate. Now, below let's look at the next slide to see what we currently have and what we are proposing. Just to make sure that we are able to continue to offer service. Remember, even with the proposed increase, it's still not up to our regular cost. And that is why, again, I want to appeal, because not all fingers are equal. If you can pay for our regular program, please pay for it. But I understand that many people, even on the current discounted program, some categories of patients are still struggling to meet up. Like I said before, over 10,000 people have reached out to us. But how many have gone through the IVF program? But 10%. So what that means is that if today we come out and say IVF program is not completely free, we won't be able to cope. There are thousands of people that will come. Why? Because it's just been the issue of money that has been the barrier. Next slide. Now let me give you some statistics so that you can have an understanding. John, why is the O called adjusting? Now, at the beginning of last year, transfer catheter, that's the catheter we use in transferring the baby into the womb. One was about 27,500. The last one we ordered for December, or was it in November? 42,250. I don't know what it will be now when we want to order. And because everything keeps going up. If you look at that, it's almost a 50% increase. Same also for the aspiration needle. Same also for some of the injections that we use. There is one injection there that is almost 100% increase. From 13,750 to 27,300. But yet, this is just between beginning of last year and now. So, ladies and gentlemen, you can see the reason why you must agree with me that we need to increase our price for the foundation from 800 to 950, and then all the subsequent additions which we have done, which does not. We are also conscious of the fact that this affects everybody, including our clients. And so we have not increased it based on the way things have gone on, because we are also mindful of that. Because like I said before, even with our current rate, a lot of patients are still not able to afford it. Last year we did a lot of, you can see, even on that 800 plus, even we did a lot of discounts even for last year, a 10% discount. And a lot of people plugged into that. Even with the fact that things were going up. All right? So, this is a special appeal to our clients. Like I've said, all fingers are not equal. There are some patients who can afford to pay our regular rate. That issue. I want to appeal, please, if you can pay the regular rates, pay it. Let me explain something that probably I've never explained before. That is why when we say a lot of our programs, particularly the Be Fruitful programs, the payments that you made, they are not refundable. It's because we work as the program, the way we run the program is as a pool. The monies you pay, both from the regular, it assists those who are coming through the foundation to be able to overall help to run our program and give you the discount that we give. I will say this now, this is the first time we're going to be making this appeal, and we're going to be having this program, turning your pain to gain. We don't get assistance from anywhere. Some people think that, the foundation, people are getting grants, money is coming. It's our own sacrifice. Because we want to make sure we make it as affordable. If not because of the economic realities, we probably would have maintained, that was the initial goal, to maintain that price, 500,000 for 2 seconds, all the additions over time. so that we can reach out to as many couples as possible. But unfortunately, what happened happened. So right now, we still believe that God can still do it. And so what are we saying? This year, we are going to trust God that we will leave, go back. We'll leave that price at 800. We will not increase it. But we also will have this price. And again, I want to appeal. If you can't afford the regular rate, you can afford this one. Pay for it. Okay, you ask, I'll answer your question later. Pay for this. You know why? Because the more people who register for the regular program and or this proposed increase, the more people who pay for it, the more you are able to help us to provide service. That's struggle. Because we understand that if we increase this to this, less people will be able to afford this. And trust me, we want the people to be able to afford it. We want to lower the bar so that more people can afford it. So please help us to maintain the current, the fruitful prices by paying for the regular or the new, the fruitful price, if you can afford it. We also, like I said before, we're also going to be launching the turning your pain into gain. And so we're also going to be calling on our precious clients, those who have succeeded, the public, well-meaning Nigerians, those who are kind-hearted, who are looking for ways to impact lives, that they can partner with us to ensure that we don't only maintain that price, but that we further reduce it. Trust me, if the resources is available, I would drop that 800,000 down to get more people to be able to afford it. Nothing is too small and nothing is too big. In the days and weeks to come, we shall be bringing out more info concerning how you can partner with us to ensure that we get everybody through the finish line, including those who are trying to get pregnant. This is what I believe. For those of us who are trying to get pregnant, you say, doctor, I don't have money. I know. But see, it's about giving. What you make happen for somebody, God will make happen for you. So you're able to afford to pay. Okay, let's say you pay the 800. And you say, okay, I've paid for this one. Somebody cannot even pay for this one at all. Let my 50,000 go. Let my 100,000 go as my seed, making sure somebody else is able to come in. And I can assure you that when you have that understanding and you work with that mentality, doors will open. All right? And then we are saying that for those who have been blessed already, who have their kids, one of the ways you can say, God, thank you, by giving back. Why? Because you have been blessed. You have come out of that pool. You're no longer barren. You are happy, you are rejoicing. But there are many of your sisters, and many of your friends, there are many women who are still on that journey. One way you can return to say, God, I thank you, is by making it happen for them. That is why we're going to be reaching out to all of our clients who have succeeded. And for those out there who are listening to me, you may not have achieved conception through our program at the Abebe Fertility Center. You may have used any other center, but you know you once faced this journey. You once was termed barren, but now God has blessed you. It is time to reach out. It is time to turn your pain to gain by ensuring that many more couples out there are able to become what you have become. All right? And what is our goal? We're trying to see how we can give a subsidy of 500,000 to every couple. That if we're able to raise God, we're able to raise funds, we're going to not just maintain the price at what it is, and for a category of patients, we'll be able to further give them a discount. All right? And so the terms and conditions of the Fruitful program, this is just put there so that for purpose of information, so that people will be aware of what the terms and conditions are. The main program is non-refundable, and I think I've stressed this before why we put non-refundable, because the way we run our program, we want to make sure you are making payment and you are starting off and doing it. When you make payment and you say, oh, sorry, I changed my mind, I'm not doing it again, I want my money back, it disorganizes the whole system. All right? And so we need to understand that it's a non-refundable program. The main circle is a two-circle program. Then the additional costs differ from one patient to another depending on the type of program you are doing and the dose of your medication. And that the additional cost is for one circle. You pay for two circles, but the additional cost you pay is for a circle. So when you pay that additional cost for the first circle and you get pregnant, you're not making any other payment. But if you don't get pregnant, then you have to pay the additional cost for the second circle. I'm sure when we pick up the cost for the Fruitful, you saw it there. Again, all of these details you can get when you call the team. And again, the two-circle program can either be a fresh circle or a frozen circle. Now, for patients who, and that we run 1, 2, and 3 circles. Okay? There's no refund once the program has started. Excuse me. So you've started the program, there's no refund. Once you've started the program, there's no refund. If you've not started the program, then there's a refund. 70% refund is the policy, refunded after 3 to 6 months. For a patient who is on a multiple circle program and you get pregnant in the first circle, there is no refund. So you pay for 3 circles. You know, let me just pay for 3 so that no matter what, I'm trusting God that I will get pregnant. And then God did it. He got pregnant in the first circle. Then I said, doctor, how far? Well, it's not far. God has done it. Exactly. So, like I said before, that fund that you paid for is not diverted to somebody else. That is how we are able to accommodate and provide a lower cost through the foundation. Like I said before, we've not received any grants. 1 or 2 patients have given to us, yes, and God bless their souls. God has given to us 1 or 2 patients, but we've not received grants, large funds of money. What I'm talking about, they've given to us is in thousands, out of 100,000. Okay, but we are committed to this time. But I have no doubt that from now going forward, all of my patients, the public, they will key into this. And by the grace of God, we shall get the resources needed to make sure that barrenness is pushed away from us very far. So I'll just talk a bit about the psychological support that we are going to be providing. Last year, I started, thinking about the journey from a different perspective and started understanding that this journey is not easy. and that apart from providing the ART services that patients need to get pregnant, we need to also take care of their mental state, their mental health. And that if that is not done, the patients will not have a great experience. And because of that, we're going to be paying more attention to the mental health of our patients going forward. Now, we are supposed to have a quick mental, a psychological evaluation done, but we will not do it in this program. We'll do it in our next program, both for those who are watching online and those who are physically present. We'll give you a form to fill. And why are we going to be doing this? We want to just know what your mental state is. It's not a joke. Few days ago, I don't know if you read it. A banker committed suicide. Okay, I'm sure some of you must have read it. Yes, in one of these banks, he just said he was fed up with life. That life was too hard. Went into the bathroom, bought rat poisoning, sniper, and took it. They were calling her. Her phone was on her desk. For some hours, she was not present. Where did she go to? We were calling. They had to search. Go to one of the toilet doors. It was locked. Forced it open, and then she was on the floor, lifeless, gone. And left a note, on a written note on her diary, apologizing to her parents, to her siblings. Her life was too hard. So the mental state of the common Nigerian right now is not in a good state. That is the truth. People are going through a lot. Even more so, those who are going through infertility. The burden is not a joke. We talked about it earlier on. It's not a joke. So what we have decided to do at the JOJE Abebe Fertility Center is to pay more attention to the mental health state of our patients, to see how we can be able to help. And it is this that has informed the introduction of the JOJE support group. Because when you have a group of people who are going through similar journeys and you're able to talk and express yourself and share information, share ideas, share experiences, and you are also able to interact with people who have gone through similar problems and they have succeeded, there's strength that comes. There's strength that is drawn from that interaction, knowing that you're not alone, knowing that the God who did it for one will do it for the other person, and you're able to draw strength one from another. And so we're going to be introducing the support group, and we believe that by God's grace, we'll be able to help and then provide professional counseling to those who may need such counseling. Not everybody, I presume. Some people may be in a better mental health state. But some people have a lot of good support system. For some people, their spouses are very supportive, no stress. The families have been very supportive, no in-law trouble, nobody has been troubling you. But some, the stress is a lot. And so we're trusting that we're going to be able to provide that needed support to those who would need it. All right? So on this note, I want to say thank you very much. I know I've been talking for quite some time now. At this point, I want to be quiet. And then I'll be glad to take questions. Thank you very much. So we'll be back. We'll just go on a short, I won't say commercial break, but nobody's paying for that break we want to do. But I'm sure that very soon, in not too long a time, people should be paying for the breaks that we're going to be taking. All right. So we'll be having time for questions at this point. So if you have a question, for those of you and we have a lot more people who are joining us online, by the way, just say that have a lot of people who are joining us online. If you have any question, please just type it on the space there provided in the chat, and then we will take your question, and then we would be able to provide you with answer. Technical guys, are they able to speak out? If for those who don't want to write, or they've written it out. Okay, good. So we will just read out the question, and then I will try to provide answers. And for those who are present here physically, you can ask your question, or if you have any contribution, you can make it, and then we can be able to take those questions. All right. Can we go ahead and take the questions, or we should wait? Okay, just a minute. Are you guys ready? Can we take the questions? Okay. So sit down, sit down, sit down. Thank you very much. Well, for those who did not hear the question is discussing with a senior colleague, he was told that there are other options that can be considered as form of treatment, and that IVF is the last option. All right. If that is true, what I would say that is partially true. Okay, I will explain. There are other options of treatment that is available. But what I don't agree with is that IVF is the last option. Because there are certain conditions where the only option, the only viable option is IVF. For example, you do your tests, a couple come in for evaluation, and then you discover that the tubes are blocked. There's no other option. It's only IVF. You understand? Or you do your seminal fluid analysis, and you have very severe low sperm count, severe motility. What are the options? Only one option. IVF with ICSI is the option. So IVF the treatment option in that category will not be the last option. There's no other option you will go for, except you want to just waste time and money. But I agree that based on the cause of the infertility, if it's due to mainly an anovulatory problem, I mean the woman is not ovulating, in which case the man is okay, the tubes are patent, then you can start off with medications to make her to ovulate. And if she ovulates, you can achieve conception. All right? And if you do that a couple of times and there's no success, you can now move to the second treatment option, which is IUI, what we call intrauterine insemination. And what you're doing is that you're preparing sperm and you inject it into the woman's womb, the uterus. You are bypassing the vagina, the cervix, you are aiding the movement of the sperm. All right? And that with that, some couples will be able to achieve conception. All right? But my take is You have to individualize every couple. When I see a couple who has done 10 years, been married for 10 years, the woman is probably 35, 36. You know, that's the age that the woman would be. But if you are married for 10 years, most women, if you marry early, you marry around that 25, 26. So when you are seeing a woman who has done 10 years in marriage, she's already 35 at least, above. That kind of woman, I will not, I won't, she won't come and I will say, okay, and she has not really done anything. She says, oh, she has not really gone to hospital so much. But if you check, that woman most likely would have used clomid at one point or the other, which is the first thing I talked about, use of medication, right? They may not have done IUI, or she may have done IUI. That woman, I won't tell her, oh yeah, let's come and start through the process of medication to induce to see if you can ovulate. Why? Because there's no time. And those other options are not as successful as IVF, by the way. So what will I do? I won't take her through those routine of having to go through ovulation induction, take Clomid, follicular tracking. Okay, it doesn't work after 2, 3, 4, 5, then move to IUI, wasting time. Why? Because the major factor that determines success is the age of the woman because of the quality of the egg. Do you understand? So I will cut off those other options and I will go straight to IVF. But if I meet a young couple, they just got married, 2 years, 3 years in marriage, and the woman is young, she's in her 20s. Okay, done the analysis, the man is okay, the woman is fine, all right, probably she's not ovulating. Then we can say, okay, let's start with that. Why? Because age is on our side. Okay? And then it's just that factor of not being able to ovulate. So like that's why I said, whatever you do depends on the individual couple. You have to individualize. All right? You're welcome. Okay? The payment. Call. Okay. Very, very important question. Yes. Okay. Yes. Yes. No. The registration is different and the test is different from that 950. That 950 is just the cost for the main program. All right. For registration is 25,000, just to say it so that those who are listening. And then for the test, depends on the test that you are doing. If it's the basic fertility investigation test, I think that is 100,000, right, team? Yes. And then if it's the standard fertility investigation, is 180. Yes. So after that, before you now pay the 950 for the 2 circles and then the additional cost. The additional cost differs from couple to couple. That's why here, coming through the foundation, no two couples pay the same amount. So if you want to compare, say, how come your money is less than my own? This doctor, it's not fair. Is this what did you do? Nothing. It's different for both of you. Yes. So it's one card. Yes, you are the one that. Yes, it's one. It's one. You don't use card. It's the system. Your information is entered. Is entered into the system. Yeah, that covers. It's for the couple. Yes, yes, it's for the couple. Now, after you've done your investigations, all right, those tests and everything, then the result will now be reviewed. Okay. However, there are certain procedures that may be needed, depending again on what is found. For example, we may do a scan for you and discover that, this woman has a lot of fibroids. And in our estimation, we think that this woman needs to take out the fibroid before she continues with our program. We ask you to do fibroid surgery. Or we try to enter into your womb during what we call the mock embryo transfer. And we're not able to succeed because the service is closed. We need to take you to the theater to open up your service. Or we do a scan for you and we discover that the inside of your womb is not looking very okay, not clear enough. We're thinking maybe there could be a problem. Then we can ask you to do what we call hysteroscopy. Put a camera through your cervix to look inside of your womb to be sure that everything is okay before you begin your program. Or for the man, it's possible that you've done your test and we say, this test result is low. This man needs to be on medication. So we'll place you on supplements to take for some months before we start the program. So all of these things are all add-on costs. They're not part of this cost. That is why no couple pays the same amount. So everybody is just on your lane. All right? Any question here before we go to the online questions? Okay, so let's pick some of why they are still trying to. So the first online question is, okay, yes, I did IVF in one hospital in Abuja. We were supposed to transfer embryos in November 2023. My period came. We moved it to December 2023 after transfer again. After transfer again, my period came. Does it mean that the doctor did not prepare me well or the drugs he gave me did not work on my body? Please, I need answers to this question because I'm afraid. Does it mean I cannot be a mother or what? Okay. So, let me just give a bit of background to this question so that for those who are watching would understand. When a woman is going through IVF, particularly if she's doing the third-party program where she's not using her eggs, what will happen is that we will prepare her with medication so that her womb will be ready to receive the embryo. Now, the question she's asking is that before it was time for her to have an embryo transfer, a period showed. And that shouldn't be. Well, once the period came before the transfer, it means everything that you have done is gone. Now, what are the things that can cause that to happen? I want to say that it happens in a couple of patients, not too many. Number one, if this patient was not properly down-regulated, meaning that you did not sufficiently take over her body system, take over her body system. And that is why for women who are going through IVF, particularly third-party program, they take an injection to down-regulate their system. Some of you would have probably heard of what they call Zoladex or Luprodex or Buserelin. Those are all injections that are given to suppress the body's hormone from acting. That way, we are the ones who are now in charge of your body system. So, once you are properly down-regulated, you will not see your period unless we want it to come. All right? So, if that is not done properly, that could be one reason why she saw her period before time. Number two, if the period of preparation of her womb took longer than necessary. For example, if a woman has a normal 28-day cycle and it took 35 days, 40 days for the preparation to take place, for the embryos to be ready before the transfer, why most women will not see their period because they have been properly down-regulated, some women will just wait and see their period because it has extended too long. And thirdly, some women are more sensitive to medications, to hormones. So what may work for majority of women may not work for some others. But you will become a mother. So what to do is to look at your peculiar case and see what is causing you to see your period before transfer is done, and then make the necessary corrections, and I'm sure that you'll achieve your goal. All right? Next question. Okay, so I'll be 50 years this year. Do I still have time or hope? And is there any promo program now? People like promo, eh? Ah! Yeah, it's just starting. Promo. Hey! The good news is that there's promo. There's all we always have promo. All right? We always have promo. We have always been running on promo. So any time of the year, there's promo. Just come, there's promo. If no, then how much for IVF? Both tests, that is everything. I think I did that presentation. So it's on the video, except maybe she probably joined late or you joined late. All of those things have been explained. So I want you to just go back. But I'll just give a brief about the question. Yes, there's still hope for you. Yes, you are 50. It's possible you have probably stopped menstruating. You have entered menopause. But there is hope. There's hope. It's just that the process by which you will get pregnant is through the third party. You won't be using your own eggs. Yes. You will require donor eggs to achieve conception. Why? Because at 50, those eggs are probably not, they're very few, or probably not even present at all. A woman who have stopped menstruating. And then the quality, yeah, even if you're menstruating at 50, you're just using the last eggs that are producing estrogen, or it's just maybe your body fat that is not producing estrogen. All right, but the eggs present there will be very few, and more importantly, the quality will not be there at all. Quality, those eggs are not good, they're bad. And if you want to try to use them, the chance of getting pregnant will be almost zero. If by miracle you get pregnant, the chance of having an abnormality with that baby will be very, very high. And so for those categories of patients, you usually suggest that they use an egg donor. In fact, from my experience, once a woman gets above 35, getting close to 40, late 30s into 40s, quality of egg makes a significant difference, whether she succeeds or not. And a lot of time we suggest to them that they consider very early the third party option. So there's hope for her. Okay? Next question. Can I make IVF? Can I make payment for IVF? Okay, she wanted to say instrumentally. Yes, you can. Yes, you can. You can make your payments in installments, but you need to get in touch with us so that we can guide you on how to do that. Okay? If you're coming through the foundation, the main payment is 800 or 950. No, let me say 950. I don't want to say 800. 950. All right? If you don't have the 950, if it's 500 you have,